All right, so tell me who you are and what your background is.
Okay. My name is Dr. Jessica K. Hairston. I'm a child and adolescent psychiatrist, and I have a specialty with in infant psychiatry, which actually infant psychiatry means children under 5. And so I work with people of all ages, and typically I tell people I work with 2 to 92, everyone in between. And I've worked with people in different settings. I've worked with people who are in the hospital. I've worked with people in my private practice. I've worked with people who are doing substance abuse and addictions treatment. People who are geriatric treatment. And in geriatric hospitals, people dealing with Alzheimer's, Parkinson's, things of that sort. I've gotten to be able to see people over the entire course of their lives. And I've learned a lot from people. I was just talking with a friend and just trying to figure out how many people I've seen. But over the, 28 years that I've been practicing, I've seen probably around 90,000 people.
That's amazing. So we had a conversation a little bit earlier about everyone in some way, shape, or form has trauma, right? So tell me a little bit about the different types of trauma that you see in the clients that you get.
I think it's really important to understand that all trauma is not the same, and that people use the word trauma fairly loosely to mean a lot of different things. So let's talk about what trauma means in and of itself. So when I talk about trauma, I'm usually talking about something that has happened to someone. But when you talk about trauma for your body, is an experience that causes stress on the body. Let's make that differentiation first, that I'm going to talk about things that happen to people versus how your body responds to what happens to you. I can talk about both, but we need to decide upon the first thing to talk about. So the first thing is I want to talk about what happened to you as a person. So when you talk about trauma, a car accident is a trauma. A near drowning is a trauma that you survived from. A kidnapping is a trauma. But so is being ignored by your parents, family, and friends. That's emotional neglect. That is also a trauma psychologically. Being yelled at and called names by your parents and friends, that's verbal abuse. That's a trauma. Physical abuse, someone hitting you, pushing you, shoving you, those are traumas, as well as sexual abuse, someone touching you inappropriately or having non-consensual sex with you, that is a trauma. And according to the age that you were when all those things happen, how you process that trauma is differently. So what I'm saying is how you process trauma from age 0 to 2, birth to 2 years old, is different than how you process trauma, say, than, let's say 0 to 3. Because language is much better at 3 than it is 2. So, but it's different than 3 to 10, where you're developing your logical thinking. It's different, again, from 10 to 18, or 10 to 18. Because 10 to 18, you're seen as a child versus an adult, a pre-teenager to adolescence, and you have less independence, less autonomy. So things change once you hit that 18 mark, and it's more of a social change than it is a biological one. But at that social change, you're more empowered to make your own decisions. And if you remember, let's say we're talking about trauma, we're talking about post-traumatic stress disorder. One of the symptoms of that is a feeling of helplessness and horror. So if once you're an adult, you have more control of whether or not you feel helpless in a situation than you do when you're a child. So a lot of things will fall under PTSD for children that may not, because you have more, that may not as an adult, because you have more autonomy as an adult. And you was, for example, let me give you a case in point so to help you understand the distinction that I'm making. So let's say for a child who is in a physical abuse situation, Once that child reaches a understanding of their own autonomy and independence, usually that happens around between 14 and 18. They'll make a decision to leave that household, and at 18 it's considered acceptable. At 14 or 15 it's not, because of societal rules in terms of how you support yourself. So at 18 you have the ability to leave situations. However, if you have had this history from the time you were born, growing up, you learn to live with the situation.
Like stuff it down.
Yeah, like stuff it down and just stay there. And you've learned to normalize the situation because you haven't had any other situation to compare it to.
Right.
You don't have any other family to compare it to. You don't have any other living situation to compare it to. Whereas, this makes a big distinction of how you process the trauma that happens to you.
Right. So in that age group that are stuffing it down,
Yeah.
when they present to you, how does it present as like physical issues first, or does it appear as like emotional dysregulation, nervous system dysregulation?
That's a great question. So how does your response to trauma shows up is really what she's asking. In terms of what I've noticed in my clinical experience, like I said, working with over 90,000 patients, is that how you respond to your trauma is it based upon how emotions are expressed in your household.
That's amazing.
It is amazing because if, let's say for example, if you are in a family that voices disagreement, then you're going to become loud, boisterous, and you're going to voice. You're going to express your anger, your frustration, and it comes out with children a lot physically, because actually the majority of households, I'm not going to say every household, but the majority of households don't have healthy ways of expressing anger and dissatisfaction. So it comes out as a slamming of a door, it comes out as a pounding of a fist, it comes out as destroying their toys, trashing their room. But if you don't speak about your emotions in your family, and it is an emotionally silent family, then what you're going to see is two things I've seen. I've seen one where it becomes converted. We talk about conversion disorders, where you manifest, or somatic disorders, where you manifest physical symptoms for the emotional expression. So if you are experiencing fear, because fear is an emotion. However, when we call it as a symptom, we could say anxiety. And so we label kids with, or diagnose kids with anxiety problems. Actually, the underlying emotion is fear. And we don't talk about what it is that they're scared of. Are they scared of their parents' response? Are they scared of their friends' response? Are they afraid of embarrassment? Are they afraid of humiliation? Are they afraid of being awkward? Or what is it that they're afraid of? Let's actually address the fear rather than calling it and labeling it a disorder. Because what you'll find out, people develop stuttering, they'll develop headaches, they'll develop tummy aches, they will develop weakness, they'll develop dizziness, they'll develop syndromes where they feel faint, and they have autonomic dysregulation. When I say autonomic dysregulation, autonomy is your nervous system and how it responds without your conscious volition, meaning how your body responds, like your heart rate. Your heart rate is a part of your autonomic nervous system, and it's controlled by the parasympathetics and the sympathetics. So when you're feeling fear, your sympathetic rears up, your heartbeat races, you sweat, you feel nauseous, you don't want to eat, that sort of thing.
It's like fight or flight.
Exactly. That's exactly what it is.
Yeah.
Fight, flight, freeze.
Freeze.
And also there's a fourth one, fawn.
Yes. And then the opposite is rest and digest, which is the parasympathetic. So tell me a little bit about that.
So with the parasympathetic nervous system, now what we're talking about is how your body responds to trauma. And your body responds to trauma. It responds to physical trauma, but it also responds to emotional trauma. So if you cut yourself, that's a physical trauma. But if someone takes a knife and cuts you, that's an emotional and physical trauma. And so your body is going to respond to both. It's going to respond to the physical trauma of the cut itself, but your brain is going to respond to the emotional trauma of the meaning you have associated with the actual event of being cut. And I'm saying that very specifically because the emotion around the event can be very different,
Right.
depending upon the situation. And for children, according to the age at which the event happened.
Right. So you've got these very vocal families and these very silent families. And sometimes the trauma goes unnoticed for many, many years, but children are still triggered, right? So if children are presented to you with one of these symptoms that you recognize and nobody has discussed trauma itself, how do you cue in on that there's a traumatic event that happened in this child's life just by the things that they're expressing, that they're feeling tummy, they're feeling, faint, they're fearful, or every time they hear a loud noise or a balloon or fireworks that they all of a sudden feel very anxious and they just can't function.
Okay, so for me, it's very simple because by the time a person reaches me, they've tried everything else. Honestly, and just to put it out there, being a psychiatrist, I'm the person of last resort. And so by the time it reaches me, it's gotten so much worse because so much time has elapsed, because no parent really wants to have to take their child to see a psychiatrist. And especially the younger the child is, the longer it will go on and when the symptoms first appear. Because it's like, people ask me all the time, why does a 3-year-old, why does a 5-year-old need a psychiatrist? And that's because we're not actually recognizing what that 3-year-old or 5-year-old has been through. So to get to your question, let's just say, how do you recognize? So the kids will tell you unless they've learned not to talk. And so that's where it comes to what family you're in. So the kids will tell you, Mommy, I don't like this. Mommy, I don't like that. This person feels weird. This makes me feel uncomfortable. And it's important to acknowledge that. And that's the beginning of empathy. It's not fully empathy, but that's the beginning of an empathy. Simply acknowledging someone else's experience.
I love that. So when you have younger children, what are the modalities? Because I know, students that I've had, or even my own children, if I was taking them to the psychiatrist, it was because one of the recommendations would be to put them on a medication. But are there other modalities that you use besides medication, or is it when they come that medication is one of the options that you prescribe?
That's a great question. So it really is like, how far has this progressed?
Right.
It's like the difference is like if you have a fever, and in the beginning of the fever, for depending on the age, like what pediatricians do, if you have a 10-year-old with a fever, it's way different than you have a 1-year-old with a fever in terms of whether or not you need antibiotics for this. Because in the beginning, it was like, well, it's been less than 24 hours, we're going to just watch and wait. So the question is, how long has this child had this symptom? So even psychiatrically, how long has this child been dealing with this? Let's say disruptive behavior, because that's how children, and it's called disruptive because this is disrupting the adults, and this is disrupting the process that the adults is usually disrupting education, because we don't call it disruption when the child is outside playing with their friends, but when they're supposed to sit down in a classroom and now listen and learn, now it's disruptive. So now that we're looking at this disruptive behavior, how long have they been there? How rowdy, how aggressive is the behavior? So when I make a decision to medicate or not medicate, it's really based on how aggressive the child has become. Like, I think people would be very surprised and shocked about how aggressive children do become in terms of hurting themselves and hurting another. And with children, I'm going to put this out. You also see jealousy as a source of aggression, because if the currency is attention, let's talk about it. If they're in terms of having a parent or not having a parent, so many children who I see, one of the caregivers is missing or absent for some reason, and that creates a separation or loss, which is also a trauma. We're going to talk about that. And so, how long has the child been dealing with the disruption? How aggressive is the child, and what's the source of the aggression? Like, is this something that I expect to resolve? Or is it something that is not easily resolvable and is going to go on for a while, and it needs to be managed? So the reason why I use medications is to help manage the aggression, help manage the anxiety. I don't medicate to the point of where it's completely, where anxiety is completely gone. I want it to be manageable. I really think that the source needs to be talked out in trauma and psychotherapy. That children need psychotherapy. Their family needs family therapy to learn to discuss emotions, because that's something I think families don't do often enough.